Hello everyone, I'm Dr. Kyle Vincent here today to talk to you about screening for colon cancer. It's a really important topic. We're going to go through some numbers and statistics that really kind of hammer home the point of why it's important to get screened and the variety of different screening tests that they are. The CDC recommends that folks get screened for colon cancer at the age of 50. That does change if you happen to have a family history of colon cancer. The rule of thumb is that if you have a family history of colon cancer in a nearby family member, first degree family member, brother, uncle, mother, sister, that at the age in which they were diagnosed is that you get screened 10 years prior to that. But for most folks, the answer is age 50. The advantages of getting screened for colon cancer early is huge. If you ever heard or had a person that you know that had a polyp, there's a number of different types of polyps. Some are more cancerous, some are very benign. But at the end of the day, you also have these precancerous polyps that can progress into cancer. So by definition and by timeline, the earlier you catch the polyps, the earlier you know what it is, the better off you can be. Not to mention any sort of procedures or medication regimens that, in the unfortunate event that you might get colon cancer, the treatment plan changes dramatically depending on the stage in which you catch it. So there's a few different types of screenings. The gold standard that I encourage all my patients to get is in fact the colonoscopy. The colonoscopy, yes, it's invasive. Yes, you undergo minor sedation. However, it's both diagnostic and therapeutic. They see everything, and if they do, whether it's an ulcer or a hemorrhoid or a polyp or anything, they can actually correct that and remove that then and there. For the folks who do not necessarily want to get the colonoscopy outset, there's a couple of different stool studies, in which case you have a bowel movement and you send in a sample of your stool. The more simplest one is just a occult blood test, which is to see if you have blood in your stool. And a little bit more of an extensive version of that test is the Cologuard, in which case it's not only blood, but some other triggers and findings to see if there's anything concerning in your stool. In any case, the colonoscopy, because it's more thorough, you'll get a 3, 5, or 10 year window of time in which you can say, okay, everything's all fine and good. For the Cologuard, it's every 3 years, and for the stool study, it's every 1 year. Those are some basic things, and to highlight the importance of screening for colon cancer, I really do encourage everyone to speak with your doctor about scheduling to getting over to a gastroenterologist to complete the colonoscopy and really get that good rubber stamp of health to say, hey, I'm good to go, and we can remove that risk from your individual health maintenance. So hope all is well with that, and once again, please get your colonoscopy.